Dr. Roshon, I
Great.
am, we're ready, Tara.
Okay, awesome. So you all know Chuck Hodge. He is our Chief of Racing and Events. Most of you know Dr. Michael Roshon, our Chief Medical Officer. Dr. Roshon is a PhD, he holds a PhD in microbiology and immunology, and he specializes in emergency medicine. And what you may not know is that since 2005, he's actually been a team doctor for several pro cycling teams, such as United Healthcare and Garmin. And so today we're going to hear from both of them. Dr. Roshon is going to talk to us about kind of the state of the pandemic, talk about how that relates to cycling. And then Chuck is going to go through not only an updated COVID guideline that is posted on our website. And Stuart, if you could maybe drop that link to the COVID resources in the chat, that'd be really helpful. And then Chuck is also going to give you some examples of some COVID protocol from different events. So Dr. Roshon, please go ahead and start us off.
Excellent. Thanks so much. I hope everyone can hear me okay. And really what I want to do today is try to give you a little bit of sense of what we've learned about the coronavirus, what the science is telling us about that, and how that has informed the guidelines that we've written to try to be able to do bike racing safe and mitigate the risks of transmitting this virus. We don't know everything about this virus by a long shot, and I'm not going to try to dazzle you with science. I'm just going to try to summarize some of what we've learned in the last year, which frankly has been unprecedented in trying to look at how much we've been able to amass knowledge about this virus and use that in ways that you all know to try to stop this pandemic. Things like understanding the transmission so we can mitigate that, things like vaccines so that we can actually get everyone immune to it. So again, I'm going to do my best to not dazzle you with science, just try to talk a little bit about what we do know and how that has informed the guidelines that we've come up with. I want to remind everyone that the situation we're in, it's basically impossible to get to a zero risk scenario. You know this from your daily lives. We're not, and bike racing is used to that. We don't expect all bike racing to be perfectly safe all the time. We just expect to do everything we can to make it as safe as possible. And that's the way this pandemic has gone as well. So I want to go through a couple of key things. One is, what do we know about how the virus is transmitted and how we can mitigate that transmission? So how can we slow it down? The vaccine is the hot topic, so I want to talk about the vaccine, how that is going to affect racing in the future, and go through some data on the vaccines for you. And then, look, I think we need to talk about the variants that are out there and what that means for the future. But I hope that is relatively good news. And then I want to look at where the pandemic is now, what the number of cases have done, and what we think they're going to do in the future. And from that, try to make a couple of predictions about when and where it's going to be safe to do bike racing. And again, that's why we came up with these guidelines, is to try to put all that together in one place for you to look at. Let's talk a little bit about the transmission. When this, let's say a year ago, when we were first trying to understand everything that we could about this virus, there was a lot of fear about the way this was being transmitted. And as you remember, it was going a little bit wildfire then, so the rate of transmission was quite high. Now we know, and there was fear that you would catch it on your bike, and that anybody who was in the peloton would catch it, and you could catch it outside on the mountain bike trails. We have learned a lot in the last couple of years, and so I want to just boil all of these papers down into a couple of simple lessons that we've learned. Number one, outdoor transmission is very rare. In some cases, almost impossible. Certainly normal outdoor activities, we see very, very low levels of transmission. Indoors is the problem. Indoor, crowded areas with poor ventilation is how this virus, this whole pandemic is being spread right now. Now, that doesn't mean you can go to an outdoor stadium with 50,000 of your closest friends and sit, shoulder to shoulder with people you don't know. But what I'm saying is normal outdoor activities, especially things like bike riding, as far as we can tell from the data, seems to be very safe. There is really, really low transmission of the coronavirus in that normal outdoor setting. The transmission that we do see is really close contacts. So there was a lot of fear about aerosolized spread. If you were anywhere in the same room with somebody who had it, then you were going to get it. What we found is that it really is standard droplet precaution. So when somebody sneezes or coughs, the virus comes out and goes about 6 feet. If you're in that zone for any length of time, then you're at risk to get it. It seems to be spread very poorly by aerosols. We know there are certain cases where that might be happening to some degree, but it does not seem to be the normal transmission. Standard droplet precautions are the ways to prevent this. And trust me, I go to work in the place where all of the coronavirus patients are every day. And if it was spread by aerosols, you would see every single physician in the country sick with it. And that just has not turned out to be the case. It takes close contact. What I want you to think about when you think about the risk and how to mitigate it is think about it like a sunburn. We're used to this, right? You go out into the sun, and it's not like you instantly get a sunburn the second the sun hits your skin. It's not like the vampire movies where you turn to dust. But what happens is the longer you're in the sun, if you're susceptible to a sunburn and you haven't done anything to mitigate that risk, the more likely you are to get it. So it's sort of like an area under the curve. How much time did you spend in a risky situation? That's how likely you are to get a sunburn. And that's the exact same way that the coronavirus is transmitted. So what that means to us, that means indoor settings, things like meetings, crowded rooms with people that you don't know, especially crowded rooms with people that aren't wearing masks. Those are the dangerous settings. Hotels, restaurants, places where you're inside for a long time, hours at a time. That's what's driving this pandemic right now. Another thing I've seen a lot of is people in cars. So if you're riding in cars with a couple people that maybe you don't know and people aren't wearing masks, that really enclosed environment is high risk. And it's a way that sometimes it seems like everybody in the car gets it. So long indoor meetings, restaurants, cars, those are the kind of things we need to avoid, especially with people that you don't know. And we're looking at trying to stop that close contact. And let me just give you a little bit of data about that. So a couple of surprising facts, and these are things that are distilled from a lot of papers. It's not just one paper. If about 70% of people that get the coronavirus spread it to 0 other people. So 70% of people that get an infection don't spread it to anyone. Even close family contacts, the attack rate where it goes from one family member who's a known positive to other family members living in the same house is less than 16%. So that is not that high when you compare it to other viruses. For instance, the attack rate for close family contacts for a virus like chickenpox or measles is 100%. If you're not immune to chickenpox or measles and you're in the house with somebody, you are going to get it. So 16% is the number here. And even of spouses, people who are sleeping in the same bed, the attack rate is less than 40%. That's really encouraging for us if we're trying to think about how to have bike races, because what that tells us is short-term contact with people, especially if you're doing stuff to prevent it, if you're outside, if you're wearing a mask, if you're staying more than 6 feet apart, that outdoor contact is really quite safe. What it means for us in bike racing is the on-bike activities are not the riskiest part. The risky part is what you're doing off the bike. How did you get there? Did you have to drive with somebody else? Did you have to fly? Did you have to go through a crowded, busy airport? Are you staying in a hotel? Are you eating out in restaurants while you're here? Those off-bike activities are really where the risk is. On the bike does not seem to be the risk in the data that we've been able to gather over the last year. So the other thing we've learned is how can we mitigate that risk? And frankly, it's the same thing that you've heard about. It's outdoors, distance, and masks. Masks really do slow that respiratory transmission. It protects both the wearer of the mask from other people, and if that mask wearer is infected with the virus, it protects them from spreading it to other people. It's very effective, maybe as much as 70% effective at stopping the spread, which is way better than the average flu vaccine is for stopping influenza. So in the early days, we were really worried about the risk of aerosol spread. That seems to be less of a concern, although you still have to think about it. It's not zero, but it's lower. We were also very worried about surfaces, disinfecting surfaces, and how much could that transmit the virus. That seems to be a much lower risk than was initially thought. So if you can concentrate on outside, distance, mask wearing, and add a little bit of hand washing, you really are doing basically all you can to prevent the spread at that point. So again, I said we were going to talk about how is it transmitted and how do we mitigate that transmission. I think that covers that. And we've tried to build these into the guidelines that we're going to talk about with you. The next thing that comes up is vaccine. So there's been a lot of talk about the vaccine. There's a lot of concern about how slow the rollout is. I'm here in Colorado. I think we've done an excellent job of rolling out the vaccine. We have about 12.5% of the population of Colorado has gotten at least one shot so far. It hasn't been as smooth all across the country, but nationwide, about 12% of people have gotten at least one shot. For the two that have been approved and widely distributed right now, it requires 2 shots for both of those. One is 3 weeks apart and one is 4. But you really do begin to get a high level of protection even before you get the second shot. So having 12% of people already have that one shot really does confer a significant protection for spread in that community. The U.S. so far has given out 59 million doses of the vaccine and is up to about 1.7 million doses a day. So the vaccine rollout is inhibited by the supply of the vaccine. It's hard to give a dose of a drug that hasn't been manufactured yet, and Pfizer and Moderna are cranking up their production, and they've really done well, keeping the quality incredibly high while increasing the output dramatically. We're going to see that increase, or at least stay steady, and 1.7 million doses a day is going to begin to make a difference. And about a third of the doses that have been given worldwide have been given in the U.S. So the U.S. really is, so far, Israel is the country who has done the best job of getting their people vaccinated. They're at a little over 50% for now, but the U.S. is behind them as one of the best countries in the world to be able to get the rollout of the vaccine. If you have any hesitancy about the vaccine, I want you to know I've looked at all of these papers on the early basic science of the vaccine development, the clinical trials, and I have to say, it's the fastest we've ever approved a vaccine in the history of vaccines, but no corners were cut. The reason this rollout was able to go so fast was massive investment by the US government in Operation Warp Speed to basically de-risk the vaccine development for the companies. So they said, we will pay for your phase 2 and 3 trials. We will pay for you to begin mass production. And by doing that, they really cut through a bunch of red tape to allow the safe and incredibly rapid production of this vaccine. When I look at the data on how effective these vaccines are, I'm incredibly impressed. More and more data is coming out about the overall safety, and it seems to be very good. If you have any hesitancy about the vaccine, I want you to give me a call. I think I can help dispel some of those myths. All right, now we're down to the variants, and what does that mean for the pandemic? I want to be clear, this virus has been changing since we very first started studying it. Since January 20, when it was initially identified in last year, we have seen variations in the vaccine, or in the virus, basically from day one. And that's the way coronaviruses work. They're constantly changing, constantly evolving. These new variants have evolved changes in the way they bind the receptor in the lung cells and in the upper respiratory cells, and they seem to bind a little bit better. And that does tend to increase the transmissibility a little bit. It's not a lot. When you look at most countries right now, the that reproduction number. If I have the virus, how many people do I spread it to? In the early days of the pandemic, that number was 2.3, which means the virus is just going to go crazy. It's just going to spread like wildfire. Right now, for most countries, it's less than 1. For like the UK, for instance, right now is about 1.1. That variant increases that number by 0.4. So it does increase the transmissibility by a bit. And that's why we've instituted more precautions and even some travel bans at places where those variants are there. But you're not going to be able to stop the evolution of this virus. It's going to keep evolving to be more and more transmissible. The real question in my mind is it a quantum leap in the transmissibility? And the answer is no. It's an increase, but it's really not that great of an increase. It's enough to make a difference between the number of cases going down to the number of cases staying flat or even going up a little bit. But it's not a quantum leap. The next big question is, are these current vaccines effective against these variants? And I know you guys have heard a lot about it. There's a lot of opinions about this. In my mind, we don't need to talk to people who have opinions. We need to look at the science. When you look at people who have been vaccinated with our current vaccines, and you take the antibodies that they produce and you ask, do they neutralize these variants? The answer is yes. They neutralize the variants. They are quite effective at stopping severe disease. They're not as effective at stopping any infection, it seems, but certainly with the UK variant, the current vaccines are very effective. With the South African variant, a little bit less effective, but still seems to be very effective at stopping severe disease, which is what's putting people in the ICU. Bottom line, we have to watch these variants. We knew they were going to happen. We know that they're probably going to get worse. These current variants out there are being tracked very, very closely, but the vaccine is to the entire spike protein, which is a huge protein. These variants are changed at 1 or 2 places within that spike protein, and so the vaccines are still highly effective against these variants. I would say against the regular strain, the efficacy of the vaccine was stunningly high. It was way higher than we had any reason to expect. Against the variants, it's still quite high. Better, I would say, than the average yearly flu vaccine that we get. So again, got to keep tracking these, but I think overall the level of protection is good. So now if we look at what's happening with the pandemic, what's happening with the number of cases right now, can we start to make some predictions about when things are going to look good for cycling and when we think we're going to be able to put on races? So what I'd like to do is show you, is talk you through what the current numbers are and why I think the cases are going down. And then I want to give you some advice on how to go and find what's happening in the area you're thinking about having a race. So first of all, we were seeing incredibly high number of cases, over 300,000 a day in the US, new cases per day, just about a month and a half ago. Those cases are now down to less than 70,000 a day. And when you look at the curve of that trend, it really went down quite sharply. Much more sharp decline than we'd seen with the previous spikes from earlier in 2020. I think there are three factors that are converging to make this last wave go away faster. Number one, we have the number of people who have been infected and who are now presumably mostly immune, probably completely immune to reinfection. Those number of cases, there's about 28 million cases, known cases in the US. We know that there's other cases out there that we don't know about. Most of the experts say that number is probably between 3 and 5 times the number of known cases. So we're talking about maybe 100 million people that have recovered from active natural infections to 150 million. That comes out to about 40% of the population. So somewhere around 30 to 40% of the population already has some built-in immunity to a next round of COVID infections, and that really slows transmission. If you add to that the number of people that are being vaccinated, 1.7 million a day, or about 60 million cases vaccination so far, those things combine to mean we're at probably about 50% of people are immune to reinfection right now. They're immune to spreading the virus. It becomes very difficult for the virus to spread once you get to those high numbers. We don't know what the actual number that will stop all spread or most of the spread, but it's probably somewhere around 60 to 70%. If you add to that the fact that it seems like people are getting more serious about following the guidelines as far as indoor meetings, mask wearing, avoiding crowded public spaces, those three factors, the number of people that are immune because of natural infection, immune because of the vaccine, and compliance with the guidelines to slow the infection, means that overall across the U.S., the cases have come down quite quickly. And I think if we look at that trend, and the trend of people being vaccinated, I think we can start to feel really good about general safety, maybe as early as late spring or early summer. Again, anybody who makes predictions in the face of this virus is guaranteed to look like an idiot. So that'll be me if this thing kicks up again. But when I look at the trends, I am really, really encouraged, and things all seem to be moving in the right direction. One of the things I want you guys to do, and Chuck, if you like, I can share my screen and just walk through a couple of slides. Would that work?
Yeah, you should be able to do that, Michael.
Okay. So first of all, I want to look at this is my favorite site for tracking the infection globally and in the U.S. Again, I'm mostly concentrating on the U.S. This is the curve of cases in the U.S. and you can see back in late December or early January, we were at 300,000 cases a day. Now we're down to less than 70. That's a really steep decline, especially if you compare it to the prior waves where the decline was much slower. Again, I think some of this is a decrease in the susceptibility, and it's harder for the virus to spread. The nice thing you can do here is if you click on the U.S. and then you go to admin 1, this will go by state. I'll just show you Colorado, where we can look at the number of cases in Colorado. And you can see Colorado was seeing about 6,000 cases a day back in December, late November and December. And I'll just promise you, our ICUs were packed. We had not a single ICU bed to spare back at that time. And now we're down to less than 1,000 cases a day most days. Really, six-fold decrease over just the space of a couple of months. That's a pretty rapid decline. So you can do this. If you're thinking about having a race in Alabama or California or whatever, you can look at the overall how the state is doing. But I think a better way to do it is to go to the county health department for whatever county you're looking at. The CDC and the public health department has distributed this data management tool to almost every health department in the world. Most of them have adopted it, and it gives you a really good snapshot. So when I click on, this is El Paso County where I live, our test rate is 5.8% positive. You really want that to be less than 5%, so we've still got a little bit of room. It'll tell you exactly what the hospital status is, yellow, so that's still warning but not severe. And you can click through and see some data. This is what I like to look at is the trend of cases. So you can see we were really up to a high number of cases back in that November, December timeline. And now we're back down. We're almost ready to go from the yellow phase into blue. Now, it's difficult to predict. So if you were trying to do a bike race in El Paso County, I would tell you to go to this website and look at it. And you want to track this as you're going to see what those cases are. This pandemic is very local. Hotspots pop up and hotspots cool down, and you need to know what the spot you're trying to do a race in is. That's going to help you put together the grid of what the risk of that race is. And just to show you that a lot of places are doing this, if I go to Orange County, California, again, I can see this same data that's put together. You can look at the total number of cases And again, cumulative cases, those are always going to go up. But again, the new cases daily, you can see a pretty rapid decrease. I will offer anybody who's thinking about putting on a race and you want somebody to look at the data in the place where that race is going to happen, and you'd like my help, all you got to do is call. I will get on these websites with you. We'll do our best to look at it and make some predictions about the future. You know, naturally, right now, it's hard to tell what it's going to be like in a month or two from now. But again, if you keep tracking that as it goes along, it does give you a good sense of what the community spread in the area that you're thinking about putting on a bike race is likely to be. All right, Chuck, that's all I had.
Great, thanks so much, Michael. If you want to, I'm going to take over screen share. And what we're going to do, folks, is I'm going to run through my stuff. We've gotten some questions in chat, and we will go ahead and pass those links on to everybody in the post-event meeting notes. Saw we had a couple questions. So thanks, Michael. Informative as always, and Michael will be around for the rest of the presentation. And again, we'll help questions, and we're all going to owe him a nice steak dinner, I think, after this is all done for his help. So, all right, moving on into my part here. I want to give some updates, take a quick look back at what we saw last year. And in our road breakout, we all reminisced about what we all went through as organizers last year. And to sort of mirror up what Michael talked about is what we've learned and how that's been implemented. I'm not going to steal the thunder from the presenters later today, because you're going to get some really valuable information from your fellow organizers who've made events work. I'm going to go over some basics, and then I'm going to talk about our I don't want to say revised protocol, but just more information that we've been able to gather and provide to you all. We'll talk a little about what we see coming up and some tools you can use. So with that said, I want to go and do a bit of an update on events. And I was thinking about a year ago this month, and I was actually flew into San Jose, California to teach a officials class. And one of the first U.S. cases that came in the U.S. came through the airport within a day of me, and it freaked me out. And I look back now and say, you know, how little we knew, but we knew what was coming, but not the extent it was coming. So go back to March last year, and first, just paint a picture for you. No one had good information to work with. As Michael said, we have learned a ton about this. We all knew or feared that this was going to be bad. And as I talked about yesterday, you know, we were sitting there wondering if moving our events a month was going to, a month from now we'll be fine. And we look back now and unfortunately sort of laugh at that. But we just didn't have good information. There were also very limited resources out there. We didn't know what was going to be going on, and didn't know how to prevent this, didn't know all the transmission. And I think everybody probably remembers the study that came out of Europe that said if you were in 30 feet of someone riding a bike, you were going to get this. And we've since learned that is not the case. What we've really tried to do, and I think you all have too, is gather good quality information and present it and look at what is the true risk and what is not, and to modify our events. But just think back a year ago and how little we knew. You know, you shouldn't be wearing masks and you didn't need to, and how that all changed. So a year later, COVID is a concern. It is still an issue and probably will be for quite a while. But there, to Michael's point, are going to be much better ways to mitigate it and control those risks. But it is going to be a concern. We have a lot of data and knowledge. Those websites he showed were not around a year ago, and it has given us the tools as organizers and as the public. There are a ton of resources. I mean, I remember having to go and try to find a mask at Home Depot to do a home project in March of last year, and there was not one to be found. Now I go in and there are boxes of them. So things like PPE, testing, there's still a limit on vaccines, but these are resources we have now that we did not have. If you all remember when if you were listening to our webinar we first did on the return to racing, a huge concern was, do you want to do an event and use all of the protective gear in the community when there were nursing homes and others without them. That is not the issue that it was. There's still some issues with testing and obviously with vaccines being limited, but as you heard Michael say, those were getting better. And we all, I think, much better understand the risks and how to mitigate them. Sometimes I wonder when I go out in public, but generally people are doing a much better job. And I think the best sort of indicator of that is just mask usage, is how it has become accepted. I remember walking into the grocery store feeling weird about it in April last year, and now I couldn't imagine going in without one. And I think we're going to see that for the future. So basically, we have a lot more knowledge and more tools to work with. What we're trying to do is take those knowledge and tools, things that we developed and that you all developed, and share those and look at what's working, what's not, and enable us to safely have events in the future. So COVID's still with us. We're going to be challenged for the rest of the year and possibly longer. I mean, this is something that's going to be with us for a long time, but probably not at the level, as you just heard, that it's going to prevent events in the future. Participants, there's now a high expectation that you as an event organizer will do the right thing, that there will be mandates that you provide to ensure people's health. And I think that's just a general expectation. It obviously changes where you are and who you are, but in general. My feeling, having come up in government service, is that we will probably be see them slow to roll back all policies. We've seen groups open up, but there's definitely a wait and see. I don't want to be the first into the pool, and we will probably be dealing with that. That goes to a discussion we'll have in a minute on working with your states and governments. We said it at the beginning, no one is going to stand up on a mountain and wave a green flag and say go. That there will be areas, as we've seen, that are going to be more impacted. There's not going to be an all clear, let's go. This is going to be a evolution, not a revolution. And for better or worse, some people are going to resist. I mean, there are people who are at higher risk, just are not comfortable with traveling or not comfortable in being in groups. Personally, I think that's going to be outweighed by the folks who are raring to go and get back, but we are definitely going to see that. And that's where the mitigation we do helps. And demand is high. All you have to do is go by a local trailhead or a bike shop, and you'll see that people want to compete. Nippy, one of our organizers, put something in chat while Michael was talking, saying that he had one of the only events in Arizona. It was a hill climb, and he had record numbers. So we're definitely seeing it, and hopefully that bodes well for us if we can just get through these last few months. So a lot of challenges coming, but I think the foundations for our sport are strong. We know the challenges out there, but we've got some hopefully good and better times coming. So I want to talk a little about our updates to the guidelines, and these are up. I'd ask you to wait till the presentation's going, so I have attention before you go roving through our website, pulling these down. Stuart is going to put a link in, and I just want to introduce a few things we've done that'll hopefully help everybody. First is we've updated our Return to Riding and Racing guidebook. The old one has the time trial list on the front with a revision date last year. Ms. Kate Courtney's on this one with the revision date from last week, and this is available. So what we've done is gone through and updated all the links and information. We've added latest information to that. If anybody sees a dead link, let me know. We'll fix it. We've implemented a lot of lessons we've learned. I was really surprised going through it how it is aged pretty well. There was a lot of, we were maybe a tiny bit later than some others, but I think we had a robust set of guidance because of that. And it's aged pretty well, but we've gone through and implemented some lessons and other things into it. We've added some guidance on working with local regulation. When we put this out last year, local government agencies just were not really prepared. And I'll give you the quick story about Colorado here, is that we worked with BRAC, the Bicycle Racing Association Colorado, which is our LA here, and Bicycle Colorado and some other groups with the state on developing their protocols for events. And I got a call from a gentleman with the governor's office, as did the other groups. And I'm talking to, and I'm realizing this poor guy has to basically create protocols, everything from youth soccer to whitewater rafting to cycling and everything in between. And having 10 people on a whitewater raft for an hour is different than having 10 people on a bike race. And he didn't understand, he was, to his credit, willing to learn, but just knowing how field size works in different categories, and does 100 mean 100 together or 100 all day? And to their credit, and we saw this yesterday with Ross talking about New Hampshire, really did listen and put out some good local regulations. So more and more we saw that through the year, whereas at first it was like, don't do anything. Added some more info on mass start events and grid systems and different waves and how to handle that, because we are seeing more mass start event comes online. Toward the end, we put a checklist for creating your own COVID mitigation, and I'll talk about that a little more. But it's just a thought process as you go through of each of these areas. What do I need to think about and what do I need to talk about? And thanks to many of our events for helping out and providing what's worked and not worked for them. This should be used with other tools we'll talk about, and this is up and ready to go and download and is open source for everybody. So we'll send that link out here in a minute. Some more specifics, we've updated our COVID tools. When you go to the website, it will not look like this anymore. Tara will talk about it later, but we're committed to keep running webinars, probably on a little accelerated scale, and keep you all updated. I've already gotten a couple great topics just in the networking sessions. We want to hear from you all what we can do and what we can provide you all to help you out. We've got sample plans I'll go into in a minute. All of our materials are available for use. We don't care if you're a USA Cycling event organizer or not. They're for the community. And we would appreciate as you come across items that are helpful, is that feel free to send to us and we will use those to help your fellow peers out. A couple more specifics on these. Several organizers have been willing to give us their mitigation plans that they've successfully used. And I just got screenshots of 4. You're going to hear from one of our organizers later who's submitted one of those, sent it into his county, and have worked well. And these are really at all levels. I don't want people to think you have to do a 40-page, beautifully designed PDF. The Colorado Classic, which unfortunately got canceled for other reasons, had a approved mitigation plan by the state of Colorado, and they've made that available even though they canceled their event. Very high level. Some of these are just Microsoft Word documents, but they've had thought put into them. They've answered the questions that the communities have asked, and these are things that are available even for their participants, so that there's a comfort level. So what we have these up on the website now. They're from your peers. We're going to add ours as we develop them for nationals, and they're available and are good templates for you to use. And we will be happy to add these on as you all provide them and provide more information on those. Along with that, all of the artwork that we have in our guide, so all these diagrams, we've made those available for our event organizers to use. A lot of people have just taken screenshots or captured them to put them in their documents. They're now all available in a folder on our website. They are fully editable. They're in PDF, but they open in Illustrator. And you can use these and drop these into any of your mitigation plans. They can be customized and changed up. If you give us credit, that's great, but we're not looking for glory in this. We're looking to help you all out. So feel free to use those. There's probably a dozen different diagrams in there. And again, they can all be modified. Some other resources I want to bring up. Stuart's going to put the link to our master resources page in there. First is there's some guidance and requirement for UCI events, and he's going to put that link up. I think we've got it on the web page as well. I've got a screenshot of their page. There's only a few UCI events who are on the call, but they've developed some good policy. And I think when you look at some of their documents, I'm proud to say they stole a bunch of our stuff. That we actually gave it to them, and they implemented USA Cycling stuff, which makes me feel good. But they have some really good information they've developed. peruse all of this, and it's, again, just more good tools for you to use. There's different levels of what's required at UCI events, but something to look at. Michael talked about it, and we will send those links out, but local and state guidance. I'd love to see the traffic level to local health department websites, and I'm sure it has spiked in the last year. So we've all had to become experts in our own way and learn what positivity rates are and things like that. But look at your local and state guidance as well as the websites for information. And some have very robust documents. We use Colorado as an example in our guidebook back in the case studies, but this applies to a lot of different states out there. CDC and WHO guidance always changing. The CDC updated their general event practices, and we've updated that link in our guidebook. It's definitely a good one to always go back and review. Is we all learn more, this always changes. So just make sure you're up to date. And one of the biggest things is just talking to your peers and seeing what works. And I'm very proud of the network of organizers who are maybe somewhat competitors who've really helped each other out on this. So continue that, and we're here to try to help and facilitate that. We're going to continue to update and provide information. We've obviously got some, I'll talk about these in a minute, some changes with vaccines and testing and other things, and we're committed to keep you guys up to date on that. Some considerations. I want to bring this up for a little bit of almost discussion. Some events do require testing. For example, UCI World Tour events. There is the UAE Tour is starting. They have protocols that are listed in those UCI documents. It's a negative PCR test 72 hours before. They've got a chart. The Belgian Federation, I've talked pretty extensively with them, with some friends I have there, and they've actually done requirement for testing at their events. Now, keep in mind, they've not had any local level events. This has all been sort of elite level, cross events over the winter, which are easier to manage. They have required that. USA Cycling is not going to put out a blanket requirement for testing for events, but it is a tool that you all have if you want to use it. A couple of you are going to be almost required to do it at the higher levels, but it is a tool for you to use, and we are working on what that looks like. I've got some information coming from Europe about how they're processing that, and this is a tool that can be used. Testing's much more available, even than it was last summer. I went out and got tested a few weeks ago after travel. It took me 2 minutes to sign up. It took me a 15-minute drive. I drove through, had one car in front of me. 5 minutes later was leaving and had results within 24 hours. And that is certainly not the case everywhere, but more and more of the country that is available. One thing with that is results management is just tougher for this. If you have a race with 150 people, managing that is easy. In Belgium, you fill out a form, you walk up, you hand them the form, you show them your negative PCR test, they check your box, and you're gone. When you're looking at a 2,000 person event, that becomes much more difficult. So this could be a tool to help enable events. It's something we're seriously looking at for our national championships, and we'll have more coming out on that, and we'll keep you all advised shortly. Vaccines. There's not a requirement right now due to availability issues. Even at the UCI level, I think they don't even mention vaccination. We're going to be monitoring that over the next few weeks as this grows. Our feeling is we will probably look at some combination of either proof of vaccination, testing, or that you've had COVID and recovered from it as we develop our tools. And we're going to share those out with everyone as we do develop those. But it's, vaccines are, as you just heard, are going to probably make a huge difference. Just some other tools, current trend. You go into for a doctor's visit, heck, I went and got my hair cut and they checked my temperature. So something we're definitely seeing. We do have some suggestions and tools for that in the booklet. And those of you who heard Rosh yesterday, Bike Reg has they call it a waiver, but it's just a time-limited form using their process. It could be something that you ask people 24 hours before the event to certify they've not had any signs and symptoms and they're not running a temperature. And that's something that you can require for them to start the event using that platform. Highly suggest that you have a mask requirement at your event. And that is probably something that your local government's going to do. We are requiring it for all officials at events, and they have not had an issue with that at all. Obviously, there are some limits there, and these are down in the book. If you're racing, it's not required, but we put some suggestions in that have worked well, which is wear them to the start line, wear them during staging, and official gives the all clear, they come off. We have had a couple grand fondos that have people start with them, and then after a kilometer, they have a sign there and they take them off and put them in their jersey pocket, and they keep them for the rest stops. So we tried to implement and put some of that information into the booklets. Also, and I've got a question from this from one of the participants. Some events have looked at exposure notification apps and tools is one more tool to use, and it's something you may consider. Some states have those. Apple's got one. They are out there, and I may ask Michael a bit to comment on how those look in Q&A. The main thing we want to point out to you all is it is critical, organizers, you follow the guidelines. That protects you, protects your participants, protect us, and that's what it's all about. Follow those, you don't get in trouble, and you keep everyone relatively safe. So that, Tara, I'm going to cue at you if I can. I saw a few questions come up, and I'm going to put both me and Michael on the spot, and we will answer questions.
Sure. So we actually had a couple questions from yesterday's open networking times. And so here's the first one. And Dr. Roshon, you spoke about the off-bike activities. So if one of you could answer, what are our suggestions on how to handle the festival, the expo, the food truck aspects of our events in the near future? As we know, these are the things that attract people to the events. So any suggestions on how to handle those aspects?
Yeah, I think you have to think about it in the context of what the spread is like in the area that you're doing it. If it's reasonable, low spread and generally considered safe, I think outdoor, uncrowded, and with masks, you can probably get away with an expo and a food truck and all that kind of stuff. Anything indoor is going to be tough. Anything indoor is going to be really hard. So that means, winter, spring is going to be hard. But most of these things are outside anyway. It does put you in the position of sometimes being the mask police. I can tell you from going to the World Championships for mountain bike and road, they were ruthless about the mask. If anyone saw you without a mask on anywhere near the venue, you would get fussed at. In Austrian, it was very intimidating. Now, if you're in a situation where you planned an event and planned an expo, and all of a sudden the cases spiked up in that community, it's going wildfire, you might think about reconsidering it.
And Dr. Roshon, this is a little tongue in cheek, but I do think it's an important question when we're looking at spread. So what is considered reasonable COVID spread?
Yeah, I think when you look at that test positivity rate and the cases per 100,000, you want it to be down in the yellow or blue range, preferably in the blue, of course. But if you're going into a place that's in the orange or red range, like we were, who would have thought about doing a bike race in Southern California back in November or December when the spread was crazy and the ICUs were packed and the ambulances literally wouldn't come to your house, right? So, it's easy when it's that bad. It's easy when there's no cases. It's the in-between that's a gradation.
And Dr. Roshon, this is for clarification. So the question is, we've heard a lot about herd immunity. Is this concept valid? And was that 60 to 70% number that you referenced earlier?
Yeah, I don't like the term. I tried not to use it. Herd immunity has always meant that you just let the virus, whatever it is, spread through the population naturally until it can no longer spread. We certainly in the US are not talking about doing that. We have said in some cases, these ages and these populations tend to have a very low risk of severe disease, and they need to be out in the community doing their jobs. So maybe we should let them do that, and understanding that some of them are going to get it, but their risk of a very severe case is bad. Nobody's talking about trying to achieve herd immunity in a nursing home, right? The key thing I'm getting at is that there's 4 factors that determine the transmissibility of a virus: the duration of transmissibility, the onset of symptoms, the overall transmissibility, like how is it transmitted, and the last one is susceptibility. The reason this virus has been going so crazy is because susceptibility was 100%. Basically, everybody was able to get it. Nobody had any innate immunity to speak of. And so that's why it was able to spread so quickly. As that susceptibility number goes down because people have recovered from a natural infection or gotten vaccinated, then the overall transmission will go down dramatically. And if we can get that R number to less than 1, you'll see it slowly decline. So I think about it in terms of declining susceptibility rather than achieving herd immunity. That 60, 70% herd immunity, or some people even say 80%. The key thing to remember with that is in the natural state. That's if nobody's wearing a mask, there's no shutdown, there's no nationwide efforts to mitigate the spread. I think if we had a susceptibility rate, where maybe 50 to 60% of people were no longer susceptible, and everybody else was following, the rules pretty carefully, you'd see the numbers decline pretty dramatically. So think about it, susceptibility, not herd immunity, because herd immunity has some pretty negative connotations.
Great, thank you. Now, for event organizers who are thinking about requiring someone to prove that they've either had COVID and are no longer testing positive, or they've had a vaccine, or maybe even tested negative, what are the HIPAA restrictions or regulations on that proof of?
I think it's pretty wide open. People tend to understand that some of those things are always suspended for the sake of public health. So it is generally reasonable to ask for either or. So I don't think that we're in any time in the near future, we're going to be in a situation where we can demand that people be vaccinated before they can do your event. I just don't think you can do that. You have to remember the vaccine is under an emergency use authorization. It's not even fully authorized yet. So we don't, it's only been out. The vaccines have only been out for a few months. We don't have years of safety data. So please don't try to force people to do it. I think you're opening yourself up. But I think you can say, show us proof of a previous infection, or your vaccine card, which everybody gets when they get their vaccines, or your negative test within 3 days. That is a very safe situation, very safe, I think. If you did that and people complied with it, and then they were doing some distancing and some mask wearing up for their off-bike activities, I think you'd have a very safe event.
And Tara, I'll address that a little as well. I think HIPAA really comes into effect when we are retaining stuff. A couple just tools. The UCI has a medical data retention policy. It's the Euro guidelines, but it's something to look at. It is on their website. The way this has worked from the folks I've talked to and events who've done it is there is a simple form it's just your name and personal information in regards to your license number, stuff you'd get on an entry form. And what happens is that gets filled out by the team or rider. They take that with the negative test form and hand over the personal information form, show the negative test form, and there's a checkbox put, and they're in. So there's no data retention, which is a big privacy concern, which I think alleviates a lot of that. Right now, that is for the way the UCI has handled in these events has been for a PCR test, but to Michael's point, I think we're really going to see vaccinations as those become more widespread put in, as well as we're looking at a proof of recovery from COVID is one of those.
Great, thanks to the both of you. Dr. Roshon, we've seen a couple of different, maybe research papers might not be the right term for this, but we've all seen some studies in which masks are kind of rated and there's video of droplets coming through various masks. Is there any like science that has to do with the airflow of, say, riders in a peloton where they're not 6 feet apart, but has there been any data that's come out specific to bike racing?
The only studies that have come out have been basically computer simulations of what the airflow does. They really are non-clinical and frankly, I don't think they're very useful. What we have seen from practical experience is I don't know of any cases of spread on a bike outside, and we're talking about lots and lots of racing all over the place, where some cases have come up positive, from people that are in the race caravan and even racers, but they did not seem to spread dramatically. And then also just local, people riding and group rides, we have not seen significant spread. And that goes along with the rest of the spread we have from contact tracing, which is in the outdoor environment, in the UV light, the lifespan of the virus and the ability to get a high enough dose of those droplets to be able to set up and establish an infection seems to be really, really low. Again, nothing safe. If your friend has a fever of 104 and is coughing like crazy, I wouldn't draft behind him. Okay. I wouldn't go for a ride with that guy. But if the people you're riding with are asymptomatic, and you're outside, as far as we can tell, it seems to be pretty safe. Now on the mask thing, again, in general, most masks are better than nothing. The better the mask is at stopping the spread of the virus, the better. There's a little bit of theoretical concern that things like just a neck gaiter might actually break down the droplet into smaller pieces that can float around in the air more. Again, that has not been translated into any clinical data that I know of. What I like are the surgical masks, the disposable surgical masks, because you can breathe through them so much easier. They're designed in a way that they're hydrostatically charged, so they have a larger pore. The pore is way larger than the virus, but the virus sticks to the mask. So it's way easier to breathe through that than it is something made out of a t-shirt-like material. So those, again, like Chuck said, back in last April, you couldn't get those anywhere, right? We were guarding those with our lives in the hospital, but now they're everywhere. And so for this kind of thing, if you're going to be at a crowd, that's probably the mask that I would choose. I don't think you need to go as far as an N95, true respirator mask. Those are very uncomfortable. You certainly wouldn't want to ride your bike with those, and I think that's absolute overkill.
And Dr. Roshon, just, with this topic of masks, there are some races or some venues that are requiring masks, no matter if you're racing or on site as support staff or et cetera. So what are your thoughts regarding the requirement to wear a mask while racing for indoor events? I
haven't really thought about indoor events. Those are definitely a little bit, higher risk. And so I would think about requiring masks for those. I don't know. Can you really race in a mask? Chuck, what do you think?
We have seen it. We had Pennsylvania required mask for racing. We had some crits run there. It was not great. Mask soaked through. We had issues with compliance, which was, when stuff falls off your face, falls off your face. We sort of treat it like the helmet rule. But what I think we pretty much found was that if organizers are going to have to do that, they just called the race, and that seemed to be the consensus. I think the question came in regards to the Detroit track velodrome, which is indoors and is closed. I will tell you that the velodrome here in Colorado, which is covered, is not open to the public. Our national team and some select others are allowed to train there as part of the USOPC, but they're going through all the protocols you'd expect. There's testing and other things. So, Michael, I think the agreement is probably more danger inside, but it's not like being in a meeting room with someone.
Agreed. And it's obviously a big area with, if it's well ventilated and people are pretty dispersed, it's safer. But or if it was crowded with tons of people milling about and closed in an area with high spread and people coming from all over the place, that would make me a little bit nervous.
Great. And so we're just over by a minute, but let me at least ask one more question. I do think it's important for folks. So one of the large concerns with getting an event back on right now is not only your safety protocol and having all of those measures in place to protect everybody, but what are our thoughts on how to help people feel comfortable with the safety protocol that the event does have in place? Chuck, do you want to maybe answer this one?
Yeah, Tara, I'm sorry, I got a little breakup on mine. Could you just repeat the last part of that?
Sure. So really, what can event organizers do to help racers feel comfortable with the safety precautions and protocols they've put in place?
Yeah, I think it's communication, Tara, more than anything else. There are people we know who are going to go out and they're not going to get this and they're going to go out and race no matter what. But I think there's a lot fatter middle of people who are concerned and will go and participate if they consider the risk well mitigated. I think it's communicating, telling people what you're going to do, following up with what you're going to do. And to Michael's point earlier, I mean, you can say you're going to use masks, and when you show up and no one's wearing them, it just makes people not feel good and not continue onward. So that would be my 2 cents, and just follow local guidelines. And just want to comment, Ashley put in there, when is this okay? When is this reasonable? And I think that's a very tough question to answer for all of us, not only us, but our participants as well. As my risk factor is different than Tara's and Michael's and everyone else. And, we need to find that area as event organizers in our particular locations where we feel we are meeting those safety guidelines, and our participants are as well. I think we've had to make some very tough decisions as an organization, and we feel like we're setting a pretty high standard of safety. And yet I hit the road to Florida and walked into restaurants with Tara for a site visit, and you wouldn't have thought COVID was going on. So it's a tough question to answer.
Hey, Tara, somebody's got some really specific questions about the numbers. Let me just take a stab at that.
Sure.
I think test positivity below 6% and cases below 150 per 100,000 gets you into a relatively safe range. That's sort of the lower half of yellow down into blue. And not everybody reports it the same way, but those are the numbers I would use.
Great, thanks.
And also look at the hospital. I'm sorry. Look at the hospital status. I guess it could be in some weird situation where the hospitals are jam packed, but those numbers are there. I don't think you'd want to bring in a bunch of people if the hospitals were already close to being overwhelmed. Usually those things track together.
Tara, to add to that, we were working with the Southeastern Collegiate Conference on looking at some guidelines to reopen racing, and hospital occupancy, which is pretty well reported generally by health departments. I think it's a good indicator, and I talked to Michael about this, that if a hospital is full, number one, it indicates that the positivity rate is high, but also we are an inherently risky sport. And if a hospital is full of COVID patients, you don't want to be taking someone with a broken femur to the hospital because they may not get the service, and they're taking up a hospital bed. And we were looking at under 85% hospital occupancy for that. as Michael said, in Southern California, they were rationing ambulance care, and that is not a good environment to hold an event in a relatively risky sport.
Great. Well, thank you both, Dr. Roshon. I know everybody loves when you're on these because they actually get to talk to someone who knows the science, and they can ask these questions like Ashley with all the numbers and percentages. So thank you to you both. We are now within our break period. So if everybody could be back here in about 7 minutes, so 2:15 Mountain Standard Time, we'll then move on to hearing about in-person and virtual events. Again, thanks to the both of you, and we'll make sure that everyone has the recording of this once it ends. That way, if you miss something, you can go back and listen in. Thanks, everybody.
Thanks, guys. Reach out if I can help, okay?